mothers may have an increased risk of back pain from carrying children. A new small study found that 64% of mothers reported pain in the lower back. Several factors were found to increase low back pain risk, including the child's weight, the mother's grip, reaching above the shoulder or below the mid-thigh, and combining rotation and side bending with lifting children.
Children with diabetes that engage in weight-bearing exercise have an increased bone mineral density. Children that participated in 2 90-minute sessions a week of ball games, jump rope, gymnastics, or jumping had a higher bone mineral density overall, particularly in the lumbar spine. Increased bone mineral density is believed to be protective against osteoarthritis later in life.
Taking vitamin D supplements could also improve bone health. Older adults who took high doses of vitamin D had a 30% reduction in hip fractures and a 14% reduction in non-vertebral fractures in a new study. These significant benefits were only seen in participants consuming at least 800 international units of the vitamin daily.
And those are this week's headlines for Chiropractic Update.
Pain medication is frequently prescribed for patients with sciatica, but a new article from the prestigious British Medical Journal reveals that there may be little efficacy in this practice. In the article, researchers reviewed 23 studies that compared placebo pills to various drugs typically prescribed for sciatica. In study after study, drugs were found to be no more effective than a placebo in relieving pain. Drugs also did not significantly help radiating leg pain, one of the primary symptoms of sciatica. Though 2 drugs did reduce overall pain, it was unclear how effective they were in the long term. This led researchers to conclude that there is no clear evidence demonstrating the efficacy or tolerability of common pain medications prescribed for sciatica. Chiropractic is a better approach to sciatica than drugs. A 2010 study found that chiropractic does not pose the same risk as surgery, yet it is just as effective. Call our office today for natural, effective treatment of sciatica.
A new study found that brain scans can reveal whether a patient will experience chronic back pain. Patients whose symptoms later became chronic had altered activity in the parts of the brain involved in learning and emotional responses. Since back pain alters the brain, it's crucial to receive early treatment to prevent it from becoming chronic.
A new survey of European chiropractors confirmed that chiropractic is safe for kids. Less than 1% of children experienced side effects from chiropractic treatments, and they were all mild. No serious side effects were reported. In the survey, 57% of pediatric patients were treated for musculoskeletal conditions, 23% for neurological issues, and 12% for gastrointestinal complaints.
New research suggests that chiropractic care can reduce chest pain in patients with discomfort related to musculoskeletal conditions. Chiropractic patients reported greater reductions in chest pain and improvements in overall health compared to patients practicing self-management of symptoms.
And those are this week's headlines for the Chiropractic Update. Many people take pain medication to reduce muscle soreness after an intense workout, but a new study suggests that practice could actually prolong the pain. Researchers tested the effects of two common pain medications on muscle soreness. After performing heavy physical activity, participants took one of the medications or a placebo drug for a week after the workout. When compared to the placebo drug, one of the drugs only slightly reduced pain. The other drug did not reduce muscle soreness and prolonged pain by an average of 17 hours. Given the either modest or negative effects of the medications, the authors concluded that their research cannot support using pain medication for relieving muscle soreness after exercise. Heavy exercise creates tiny tears in the muscle fibers. This triggers an immune response that involves inflammation and soreness. Pain medications may disrupt the natural recovery process by suppressing the inflammatory reactions essential for healing. Another recent study suggests that massage therapy could be a much more viable option for muscle soreness. In this study, men received a massage after biking vigorously for an hour. Muscle biopsies revealed that massage reduced cytokine levels and stimulated the mitochondria that assisted in cell regeneration. This suggests that massage can relieve muscle soreness while supporting the body's natural healing process. To learn more about natural relief of muscle soreness, contact our office today. We all know that leading a healthy lifestyle can significantly reduce your risk of developing diseases. Now scientists are beginning to understand exactly which lifestyle habits may increase your odds for having chronic pain. New research points to at least two factors: smoking and obesity. A recent study tracked 11,000 people in Finland over the course of 28 years. When participants were 14 years old, they completed questionnaires about their health and lifestyle, like whether they smoked or participated in sports. Nearly 30 years later, researchers discovered that women who were obese at age 14 were more likely to develop sciatica severe enough to require hospitalization and surgery. While obesity was a major predictor of sciatica for women, smoking played a larger role for men's development of severe sciatica. Former and current smokers were also more likely to develop low back pain, regardless of gender. But smoking doesn't just increase your risk of sciatica and low back pain. It also plays a role in the development of other chronic pain conditions like fibromyalgia and neck pain. Another study looked at lifestyle factors and the prevalence of pain conditions in 6,000 women in Kentucky. Women who smoked or were former smokers had a much greater chance of having at least one chronic pain condition. Daily smokers had the highest risk of all. In fact, smoking was more strongly associated with chronic pain than old age, education, and obesity. Still, researchers pointed out that many lifestyle factors contribute to chronic pain, like physical activity levels, occupation status, and stress. Your chiropractor can advise you on practicing healthy habits to minimize your risk of developing or aggravating chronic pain. Call our office today to learn how you can lead a healthier life.